Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, March 28, 2023. And our top story today, fight colorectal cancer, prevention, treatment, and research to prevent the second leading cause of cancer. And joining me now to discuss this and a lot more, Carol Motika is the Patient Education Coordinator for Fight Colorectal Cancer. Carol, it's great to see you. Thanks so much for joining us on the program this morning.
Thanks for having me, Jeff. I look forward to our conversation.
Yeah, this is really an important conversation. I think before we get into your story, which is an amazing story, there's so many facets to it. Let's talk a little bit about colorectal cancer. It's on the rise. It's almost like an epidemic post-pandemic. I mean, this is something that has just increased and increased. And how are you seeing this, and what do you hear from your colleagues at the Colorectal Association?
Yeah, so I work for an organization called Fight Colorectal Cancer, and we definitely see a big uptick. And we're not sure what that is yet. We're working on that data. We're working on opportunities to fund research to understand why. But we definitely see in the 45 and under age that colorectal cancer is definitely on the rise. And by 2030, it's projected to be the leading cause of cancer death between the demographic age 20 to 49. So we really have to take action and make change, or we're going to see that continue to get worse.
And we're going to talk about detection and treatment probably in segment 2, but let's talk a little bit about your story. You want to share some facets of your story. I think it's pretty interesting. Let's talk first about detection. How did you find out about having cancer? And it must have been a complete and utter shock for you and your family.
It totally was. I was in complete full health. I ran every day. I hiked mountains. Was super active as a mom of 4 adult sons. And one day I had a really bad pain in my shoulder, and I ended up in the ER. And from that pain in my shoulder, we started to investigate. I was really fortunate that I had a doctor that was really thorough in looking for what was going on. And we found tumors on my liver, and subsequent tests verified that it was actually differentiated pain. That was pain from my liver that was, coming up into my shoulders. And I was diagnosed that Sunday with stage 4 colorectal cancer. Looking back, I think there were maybe symptoms that I was not recognizing. And I think a lot of times that's what we do. We push them off to stress and things like that, raising a family, being busy. And I think that when we have the opportunity, sometimes we are misdiagnosed too. So that's a little bit about where I was and how I was diagnosed.
And just, so you had some shoulder pain. I'm pointing to my left shoulder, but I'm not sure exactly, but is that common? And what are the typical signs that you might see if you might have this form of cancer? I mean, where would it refer pain, or where would you see it?
Yeah, mine was a little unusual. I didn't notice symptoms until my liver was so full of tumors that every time I took a breath, my diaphragm and my liver were, hitting, and it was causing the pain. Traditional symptoms are oftentimes things like blood in your stool, abdominal cramping, problems eating, problems digesting. So those are really important things that if you see something like that as a symptom, you want to seek out medical intervention immediately.
And in terms of testing, I'm 50, and I have to get a colonoscopy. People typically 50, there are tests to detect this. Had you undergone? I think you got this at a relatively young age. You're still young, by the way. But is this something that when they're testing a younger person, would this be identified, or is this completely missed in people at the age that you were?
That's the tricky part, Jeff. I was 42 when I was diagnosed, so I didn't fit in any of those spaces to have screening or to have a colonoscopy. That starts at age 45. So for me, I was a little unique with my symptoms and how it related to, to the diagnosis. However, you are 50, so you should have already had your colonoscopy.
I did. I can, for this
Yay.
audience's benefit, I've had it. It was an experience.
Yes, but the good news is that colonoscopy is way better than having cancer. I can promise you that. But bottom line is, I think that that early diagnosis space that we were speaking of earlier, that 45 marker where, we want to have colonoscopies, right? So there's this space for information that we don't understand, why people are getting diagnosed early and we're not sure what to do. So we've made space for, for testing that can occur at an earlier age. If you have a family member that's diagnosed at an early age, a first generation family member, you get to go back 10 years from that diagnosis. But there are so many exceptions. For example, my son, he had the same genetic hereditary marker that I have. And so he was 19 years old when he had his first colonoscopy, and he had 3 precancerous polyps at age 19. Wow. So, going back to that 10-year look back, he would have been 32 and he would have had stage 4 cancer at that point. So I think there's a lot of opportunity there to do some work into making sure that we do appropriate screening. We go to our physician and ask those important questions. And then we follow up with the appropriate screening, whether that's Cologuard, a FIT test, whether that's colonoscopy, whatever that looks like. Those are important conversations that we need to have with our physicians.
I want to, once you were diagnosed, let's go back to that and let's talk about the reaction of the family and the community around you, because I think we'll talk again, we're going to talk about treatment, but what was the reaction like? Obviously you're young, you've got 4 children. The reaction must have been complete and utter surprise, being scared, probably a full range of emotions.
Yeah, I mean, I certainly was scared. I think anyone that's human has a fear of the formidable future of what that looks like, right? I think as a cancer patient, we see mortality differently. I think all of us as humans, it's kind of over there, but when we get diagnosed with something that could take our lives rather rapidly, that mortality idea becomes, right present in the everyday world. And I had an amazing community who loved me and supported me, but I didn't have people that understood ornately, what I was doing and what this experience looked like. And I was fortunate because I didn't want anybody to know how I was, like how it really felt to be me. But that was something that was really hard for me to grip. That my community loved me and they wanted to do whatever they could to help me. But that space for community still was not present that I needed.
So Carol, you had this, I mean, it's shocking for you. It's shocking for your family. I'm sure everyone is scared. Your children are scared. Your family's scared. You're scared, of course. How do you seek out treatment? So take us through that, picking the right physician, the right surgeon, all of those things to help you along the way. Because it does take a village, but you've got to kind of pursue and see this through.
Yeah, looking back, I honestly can tell you I was really fortunate to, be in Ohio and know and understand that I had the Cleveland Clinic right next door. So I was really fortunate in that respect. Looking back, I didn't have any clue what to do. And you feel like you're on an island and you just really don't know. And that's a hard part of this, is because we really need to advocate for ourselves, right? And we just kind of get pushed into these spaces and we don't know what we're doing. And information is coming at us so rapidly that it's hard to know what the right thing is. So I always advocate for, like just your gut feelings, your gut instincts are what you need to go by. And then advocating for yourself, as far as treatment goes, don't ever, I want to encourage everyone to never feel like, they have to choose what their physician is telling them to do. This is our opportunity to be able to choose. Our physicians are there to guide us, but ultimately this is our life and we get to make those decisions. And it's okay to seek out one or two or three or 100 different opinions on what there is as far as treatment goes. I was lucky. I was at the Cleveland Clinic and they were doing novel research. They were trying new techniques to, to save stage 4 patients. I had a liver transplant. I happenstanced into that whole situation. But looking back, I would definitely say the first thing is you have to know that this is your life you're fighting for. And so you have to advocate for yourself. If you don't feel comfortable, then seek out another opinion or seek out spaces that can help you figure out what those choices are and guide you through it.
Yeah. Well, Carol, as I said, I need to take a very quick break. When we come back, we'll talk about treatment, the research, and also advocacy. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Tax audits, tax liens, wage garnishments.
Every day we hear stories like this about good folks who are simply struggling to pay their bills. Each of them are living a frightening IRS tax nightmare, and they are afraid it will destroy their lives.
I'm a divorced single mom, and my ex-husband left me and the kids with a lot of unpaid bills, including unpaid taxes. I was really starting to show my stress on my kids because the IRS had sent me a letter demanding a huge payment from me. I couldn't afford it. So then the IRS was threatening to garnish my wages. I'm already living paycheck to paycheck. That would have put me over the edge financially.
It truly seemed hopeless, but then a friend at work told her to call the tax relief line.
The people at the tax relief line, they told me about something called innocent spouse relief. They worked it out so that all of the taxes from my ex are not my problem. I don't know how that works, and I don't care. All I care about is that I don't owe the IRS a dime, and they are not going to take my paycheck.
Even if it seems hopeless, you should call the number on your screen right now. There is absolutely no cost for the call or the consultation. You are under no obligation. If you are worried that the IRS could garnish your wages, seize your assets, even take your home, call us right now. The Tax Relief Line is here to help you. Now you have a knowledgeable, professional team of tax experts that are ready to negotiate with the IRS and fight for you to save you money. The Tax Relief Line's professionals have successfully negotiated thousands of cases, reducing and sometimes even eliminating the tax debt for their clients. It's very easy to get started. Simply call the number on your screen right now. You don't have to live in fear anymore. The call and the consultation are free.
Well, Carol, thank you so much for staying with us, sharing your story. Really appreciate you hanging around for segment number 2 this morning.
Not a problem. Glad to be here. Glad to advocate.
Yeah, yeah, absolutely. And this is going to help open the eyes of so many people. You've done a lot of work outside of being a patient. You've done a lot of advocacy work. Tell us a little bit more about the treatment. So ultimately, you wound up with a transplant, but from A to Z, how long did the treatment take? You mentioned Cleveland Clinic was doing novel research around this. In terms of a timeline, from complete diagnosis to, I guess, curing, if that's for lack of a better word, what was the timeline like?
Well, I think we never want to call it cured. I hesitate around that word.
Sure.
Just because that's kind of I think a scary place for us survivors. But I started in April of 2016 and I did a year of treatment. And so I was in acute care. I did several rounds of chemotherapy, the traditional things. I had an HAI pump that delivered chemotherapy right to my liver, which was inundated with disease. I had a 3-stage hepectomy. So we took out my colon, we took out some places of my liver that were damaged. Ultimately ended up getting through all those things, and I didn't have any disease, but my liver suffered. And so as a result of all the chemo and the surgeries and the things that had happened, my liver went into liver failure. And there was an opportunity at Cleveland Clinic. My surgeon, Dr. Federico Asejo, was, doing some novel research in the idea of heart organ transplant for metastatic cancer. And so my disease was limited to my liver and my colon, and I had all of that disease removed. And so I became a candidate for a living donor liver transplant. And that took place in April of 2018. A friend of mine from my congregation at church offered to donate half of his liver to me.
Carol, let's talk about that transplant. You had a donor from your congregation, as you said. How did he become aware, and how did that process all work itself out?
Well, I was the youth director at my church for many years, and my pastor came to me. Everyone in my congregation understood what was going on, and they knew I was sick. And he asked if it would be okay to put a note in the bulletin that said that I was seeking a donor. And we did that. And Jason was a parishioner in my church, and several people offered their organ. And Jason was actually the match. He was the perfect match. And so we transplanted. He gave me half of his liver. I have his left lobe, and he still has his right lobe. And we're all doing well almost 5 years later. So I'm still clear of disease, and Jason is back to full health. So
and that, I mean, it's you think about it. I mean, it is absolutely amazing that someone within your community, a lot of times to get a match, I think there are services that match people up, and it's absolutely amazing that, within your community, a lot of people stepped up and said, "Hey, I want to do it. I want to be a part of that."
Yeah, it makes you feel, loved and cared for, and it's humanity at its finest that Jason would be willing to sacrifice, his summer and and take chances. He has a family, and he has 2 beautiful children and a beautiful wife, and to do something like that is just, I think, the epitome of brave and courageous.
Yeah, and so you two share obviously a very close bond. I mean, you're sharing a liver, and so you have this sense of connection with one another. So let's talk about post, the liver transplant. How are you feeling? How are you doing? How's everything going with you and your family?
Everything's going great. A year after I had my transplant, I kind of came out of the space of acute care, and I felt like it was time for me to do something and give back. I felt there was this really big pull that I needed to make something better, change the trajectory of someone else's life, and share the story so that I could make a difference, that it mattered, and that all of these things that I was going through could help somebody else. And that's when I kind of dived into advocacy. I got involved with Fight Colorectal Cancer. I went to a conference. That's where I met Mike, my husband. We both had the same ideas of advocacy and how we needed to, do something with this story. We both said that the easier thing for us both to do would be to do nothing. But the harder thing and the most powerful thing would be to use this really bad situation that happened to us, again, to empower people and make change, whether it's legislation, whether it's making sure that you get screened at the appropriate times. If one person was saved or it made a difference for one person, Mike and I both said that's what mattered, and that's why we do it. So,
and I mean, you're talking to I would say a pretty large audience. I don't want to pat myself on the back, but there's people that really want to be participatory and help. Let's talk about some of the research that's going on. How can people who maybe haven't been diagnosed, but maybe they know somebody, how can people participate? What kind of research is needed? What kind of research is being done, and how can people join in to assist?
Yeah, there's a lot of research out there. The first thing I would say to anybody that's kind of new in this space or looking for an opportunity to be together with people, I would encourage them to visit fightcrc.org. That's the organization that I work for. It's just a beautiful community of people. We're all champions in the fight together. And that's a really great resource tool to find all the opportunities to engage in advocacy or research. There's just so many opportunities that exist within our community. And that would be a great place to start. As far as research goes specifically, I think that's where legislation comes in. And we just got back from a really great event with Fight Colorectal Cancer called Call on Congress. And we were able to go to our legislative leaders per state, and we were able to talk to them about what we need to do. The DOD needs to help us. And that's where research starts, right? And we're the only top 5 cancer that doesn't have a specific program designated dollars that are marked for us to research, to figure out why people under the age of 45 are getting cancer so much faster than it used to be. We're leaving good research on the table. So when it comes to that research, legislative initiatives are what we can do. We can go to our congressmen, we can go to our representatives and say, help us make a difference. Sign these bills, and let's make this happen so that we don't leave good research on the table, and we can make a difference, and we can save more lives.
Yeah, well, it just makes a lot of sense to me. I mean, this is one of the fastest growing cancers. It's almost at an epidemic level. It's reaching younger and younger people. It seems like we need to carve out funding specifically for this type of research to deal with it. Carol, we're going to have to leave it there. What a great story of empowerment, and really appreciate you joining us on the program this morning, and we look forward to having you back on the show again very soon.
Thanks so much for having me. I really appreciate it. I just want to end it with saying, remember, this is no longer an old man's disease. If you're 45 or over, have your colonoscopy. If you have a colon, you're at risk for colorectal cancer. And there are easy things that we can do to know it, prevent it. And that's what we want to make sure we get that message out.
And that wraps up this episode of BRN AM. Have a topic of interest, somebody you think we should talk to? Drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, or visit our website, and of course, all of our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving. Don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.